Surgery begins with placement of the stereotactic frame. Here we used the Lexel frame, but we now prefer the CRW frame because of its greater rigidity in cases of dystonia or severe tremor. Conscious sedation or general anesthesia is used as indicated for frame placement and to obtain an adequate MRI scan. We obtain a volumetric contrast-enhanced T1 and an inversion recovery for gray-white differentiation. These studies are loaded onto the Trion workstation and merged together using auto-merge. On the workstation, the frame is registered and the ACPC line demarcated. Targeting of the postero-ventrolateral region of the globus pallidus interna is based on the ACPC line. Trajectory views are used to ensure that the planned track avoids cerebral veins, sulci, and the ventricle. Based on the planned trajectory, the arc is used to precisely position the opening and the burr holes. We use the Axon microdrive system from Fred Hare Corporation. The cannula is inserted and the microelectrode is aligned. This consists of a 0.5 to 1 megohm tungsten or platinum iridium electrode capable of isolating and amplifying individual action potentials. The microelectrode is advanced by means of a handwheel potentiometer connected to the drive motor. As the microelectrode is advanced, several nuclei are encountered in turn, each containing neurons with characteristic firing patterns and rates. The details are carefully recorded for analysis after each track. We are increasingly relying on a custom computer program that automatically tracks position of the microelectrode and superimposes the data collected on a patient-specific deformable atlas of the basal ganglia. Cells that fire with a bursting or pausing pattern are characteristic of the external segment of the globus pallidus.
Good example of a pauser, what we call pauser.
Regular firing low-frequency neurons, so-called border cells, are encountered at the borders between nuclei in the globus pallidus. The internal segment of the globus pallidus contains high-frequency units that are relatively regular without long pauses. These units are examined for their activation by passive and/or active manipulation of the extremities.
Bring your leg up, down, up, down, left, lift it up.
The location of the optic tract is determined by flash-evoked potentials and/or microstimulation. The plotted recording track is then fitted to standard atlas sections which provide a guide for their interpretation. Length of the GPE and GPI segments, presence of driving, and optic tract and internal capsule responses provide clues to anterior, posterior, and medial lateral location of the track. The XY stage is repositioned for a new track. Typically, 2 to 4 tracks are necessary to adequately map the globus pallidus.